Optima Living operates high-quality seniors living communities across the lands now known as Alberta and British Columbia, traditional territories of diverse Indigenous peoples. We acknowledge that the lands where our communities stand and that our staff and residents call home are the traditional territories of many First Nations people, and we recognize their history. Hello, everybody. Today, we're here to talk about a really interesting topic, but we want to have a little fun with it, so we decided to call it Happy Bladder, Happy Life. And I'm here with the University of Alberta Chair of Healthy Aging, Dr. Adrian Wagg, who, among other things, besides being an expert in many things, including jokes and very good, dry, witty humor, which we may get in some of this, he's actually a world-renowned expert in bladder health. And one of the conversations we really wanted to have was to start to think a little bit, Adrian, about the correlation between bladder health and quality of life. It's probably not apparent to most, but why is bladder health so important for people when it comes to their quality of life, particularly as they age?
When your bladder goes wrong, if you like, for whatever reason, it impairs your quality of life. If you think about, say, people who have accidental leakage, and that's not uncommon in later life. So up to 1 in 4 women, up to 1 in 12 men, they start doing things differently to accommodate to that. And in a way, the bladder symptoms start to dominate their life and can really dictate what they do or what they don't do. Many people will not only start to wear containment products or pads, which they find inconvenient and then have to store or take around with them, but then don't go out as much, become more socially isolated, stop exercising, stop getting as much activity, and there's a pretty significant relationship between depressive symptoms and people who have bladder symptoms. So it just demonstrates the impact it has. And for those people that work, they have more days off, less productive, and have more work-related stress. So yeah, it has an impact.
And so how do we think a little bit about the aspects that impact bladder health?
Essentially, bladder symptoms are more common as you get older. And they may, the culmination is accidental urinary loss, so urinary incontinence. But there are lots of other symptoms that occur in association with aging, partially which seem to be a result of changes in the physiology of how the bladder and the kidneys work producing urine and how you respond to it, but also changes in the brain, which dictate how you respond to the signals your bladder gives you. So by the time you're 70, say, you'll be getting up once at night to pee. Now, for some people, it's 2, 3, 4, 5 times. There are reasons for that. There might be for men, the fact that the prostate's causing some obstruction to the outflow. For some people who are having premature signals of the need to pee at night, and other people who bizarrely produce greater quantities of less concentrated urine at night, which just overwhelms their bladder capacity. Now, all those things are treatable and often curable.
It may seem like a trivial question, but tell me the difference between, or maybe there isn't any, between incontinence and bladder health. Like, what are the correlations and what does the word incontinence really mean?
So incontinence is simply accidental loss of urine.
Okay.
That's it. And it says nothing about how often, how much, when, how long. Well, that's fine. That can be dealt with. So other bladder symptoms are, excessive urinary frequency. That's when someone feels they're just going to the toilet too many times a day. It seems abnormal. Getting up lots at night, so nocturia. And then there are other symptoms. We medically split them up into symptoms associated with the storage of urine and then symptoms associated with peeing. So typical storage symptoms are those frequency, this idea of urgency, a sudden desire to pee that you really have trouble holding on because you fear you might wet yourself. Getting up at night, and then incontinence if you cough, laugh, or sneeze, so exertional or stress incontinence. And then the voiding symptoms, hesitancy. At the lavatory, think pee, nothing happens, there's a big delay, then you go. Very common, but can indicate some kind of obstruction. The need to push or strain, having a very poor stream. You're standing in front of the lavatory as a guy and wetting your slippers, typical weak stream, but affects women as well. And that's a bladder problem, not just a prostate problem. And then the feeling of not emptying your bladder properly and dribbling either in the lavatory or when you've left it. So there's the kind of symptoms that commonly affect people.
But when do you know that your bladder health is fine, normal, or that it's abnormal? And what types of things should people watch out for?
So I guess it's easier to describe what is normal. So usually, continence is a learned thing, and part of successful toileting is recognizing the need to pee, being able to hold on to a socially convenient time and passing urine in an appropriate place. That's all part of social continence. A normal pee is 3 to 450 mils, so a Coke can full and a bit. So you should go with a normal fluid intake in a temperate climate, 1.5 to 2 litres. You go about 6 times a day. So it's reasonably easy to say, well, that's a normal bladder habits. Then you get those symptoms, and often those symptoms come on in later life, particularly in women postmenopausally, and in older men, often but not always due to enlargement of the prostate in association with aging. But obesity, diabetes, poor diet, poor levels of physical activity all predispose people to abnormal bladder health.
When is it that they should say, okay, I should go and get help? And what type of help should people be getting?
So there's 2 problems. There's a lack of awareness about what can be done in the general population. There's often a normalization. So people will either delay seeking help or not seek help because they think it's normal for getting older. Up to 1 in 4 women over 65, for instance, will think, yeah, it's normal to wet myself because I'm getting older. There are very simple things to do. If you feel that your bladder symptoms are affecting your life and causing bother, that's really a very personal opinion. But if you have bothersome lower urinary tract symptoms, that's when to seek help. And there's lots of resources on the internet from the Canadian Continence Foundation or the urological associations or the obstetrics and gynecological associations aimed at patients with a problem. And self-management can probably deal with the majority of symptoms and manage those without seeking help. But of course, there are professionals out there who can offer help and reinforcement of the right thing to do depending on the nature of the problem. For those people that have exertional incontinence and even urgent, what we call urgency incontinence, will go straight to pads without even thinking about what can be done by yourself before you seek advice.
Yeah, so let's talk a little bit about that. What types of things can people do?
The first thing is a combination of pelvic floor muscle exercises, which women do pre-childbirth to maximize their pelvic floor strength, and men do for after prostate operations. That's the first line treatment for any kind of incontinence. They can be done with supervision of a pelvic floor physiotherapist, but it can be done on your own. The results aren't quite as good because a personal trainer gets better results, but it's a very acceptable first line management for any kind of incontinence.
So when is it more than incontinence? Like when are there signs that it's more than just a bladder or urinary problem?
Clearly, accidental bowel leakage, as it's called in the public domain, are, again, up to 10% of people in late life will have fecal incontinence, but only about 2% say that it's a problem and seek help. So you think about stigmatizing illnesses, urinary incontinence and fecal incontinence are great examples of that.
When should one be worried it's more than just incontinence? That there's what are the signs that someone should be very worried? I mean, I would assume the first one is if there's blood in any sort of urine. Otherwise, you're
yeah. So
worried.
So there are the things we call red flag symptoms. There's something else going on, and that would be, as you say, blood in the urine. And there's a huge campaign, there's the public awareness of blood in the urine, and that can be an indicator of your bladder tumours or infection or bladder stones and pain during peeing. Those are the 2 simple red flags that everybody should be aware of and go to the seek healthcare advice early if that happens.
One of the areas that some people get very bothered by is having to get up lots at night to go to the bathroom. Are there things that you think they can do to help themselves or to get better at that?
Yes, I think there are a couple of very simple things you can do. Certainly not to drink anything after 6 o'clock in the evening. That would clearly limit the amount of urine produced at night. The second thing is actually to limit salt in your diet. If you typically add salt to your food, then reduce that or stop, and that will also have an impact on the amount of urine at night. The other thing again is to make sure you're not going too frequently in the day and inducing a small capacity, high frequency bladder. So you can actually drink more when you're at home and hold on like Billy-O to stretch your bladder up, and that can reduce frequency too.
Awesome. Well, thank you. This has been really helpful, learning a little bit about happy bladders and happy lives, because obviously, there are these small parts of life that limit you from having the best quality of life. And sometimes people don't always talk about them, but they're really important to just make sure you get right. And it'll probably be very helpful for them in the future.
Thank you.
I'm Mary Wood. I've been a physio for over 40 years, and I've been helping males and females with bladder, bowel, and sexual function for over 30 years. I'm also clinic director at CURA Physical Therapies, where there are 9 physiotherapists with a special interest and expertise in treating pelvic health conditions, including John, our male pelvic health physio with a special interest in all things male. You're going to develop awareness of where these muscles are. Learn how to activate these muscles by contracting them and relaxing them. Learn 2 different ways of working with Kegel muscles and doing these exercises on a regular basis over the course of 3 weeks should help you with your symptoms. If after doing these for 3 weeks, you're not seeing any change, you need to get help, and there is lots of help available for you. Managing or improving pelvic health symptoms, whether it be leakage or frequency, urgency, or even sexual problems, that the research is clear that pelvic floor muscle training, Kegels, are the first line of treatment. And the research is grade A. There's not that many areas in physiotherapy that we can say have grade A support. So now that you know what we're going to do in this session, let's help you find your pelvic floor. So what I want you to do is I want you to sit up tall and be aware of where your pelvis is, and specifically be aware of the 2 bones, your sitting bones, that you're going to be on. And I want you to just shift side to side. And then you're going to be aware of the soft spot in the middle. That soft spot is what you can feel from the outside of your pelvic floor. And that pelvic floor is attaching from the tailbone at the back to the pubic bone at the front. From that soft spot in the middle, it may not seem like there's a lot there, but when you look inside, you can see that there's an extensive muscle that's there to support. For both females and males, it's supporting the bladder that's at the front, just behind the pubic bone. For females, it's then supporting the uterus and the vagina, and for both males and females, deep inside that pelvic floor is supporting the rectum. For females, that means that the pelvic floor has 3 openings, and for the males, 2. So now that you have that awareness of where your pelvic floor is, we're going to talk about how to activate this pelvic floor. You can stop rocking side to side, but please remember that awareness of that soft spot in the middle that's connecting the tailbone at the back to the pubic bone at the front. Because I'm going to describe how to do a pelvic floor exercise, also known as a Kegel. Because what you're going to be trying to do is you're going to, like with any muscle, you want to activate it by contracting it or tightening it and being able to relax. The important part for many people with pelvic floor muscle training is that they can't relax their muscles. So please be aware that that's something we're going to focus on. So thinking of that soft spot in the middle, and then having awareness of the tailbone at the back and the pubic bone at the front, you're just going to try to tighten those muscles and then relax. You should feel that soft spot, there's feeling a little bit of a lift and then a relaxation. There's a number of cues that different people will respond to. So we're going to run through some of them, and I want you to be aware of which one is the easiest one for you to connect to and feel that contracting or lifting and then that full relaxation. So the first one is, I want you to imagine your tailbone at the back and then the pubic bone at the front, and just imagine you're bringing the two bones together and then relaxing completely. So that's an anatomical cue. The next one will only resonate for females. I want you to imagine your vagina is a rose. And with that, you're going to, when you contract, it's imagining a rose closing, and then when you relax, that rose is opening. For the males, what I want you to think about is you want to imagine that your penis is the head of a turtle. And when you contract, you're pulling the turtle head into the shell, and when you're relaxing, the turtle head's coming out of the shell. So those are a couple of options. And now we're going to go 2 more options. This next one is, again, works more for females. And that is, imagine there's a blueberry at your vagina, and when you tighten, you're pulling the blueberry inside, and when you're relaxing, the blueberry's coming out. For males, the other image that works is just simplistically pull your nuts to your guts and then relax completely. It's important that you have that awareness of both contracting and tightening and relaxing. For many people with pelvic health problems, the problem is that they're often not relaxing their pelvic floor. So it's like their pelvic floor is in a fist. And so you can imagine that if you're thinking you need to tighten, but you're already in a fist, it's not, you can't go any further. So that's why I'm emphasizing you must be able to feel that relaxation. So you've got a place to contract from. You have your cue. I'm going to get you to do a number of these contractions because now I want you to think about, are you holding your breath? You shouldn't be holding your breath. Are you tightening your legs up and squeezing your legs? Are you sucking your stomach muscles in and your abdomen in? Those are all the 3 common problems, especially the one where you tend to hold your breath. The reason you don't want to be holding your breath is that when you breathe in, your diaphragm pushes everything down onto the pelvic floor. When you breathe out, the diaphragm comes up. So having the pelvic floor contract is going to be much more natural on a breathing out than a breathing in. So again, I'm going to get you to practice just doing that cue that worked for you and make sure that you're not holding your breath, you're not sucking your gut in, and you're not tightening your legs. So now that you know how to find your pelvic floor, the cue that works for you, let's go into pelvic floor muscle training or using your Kegel muscles to get better function so that it'll help with your symptoms. The first one we're going to do is what is considered a traditional Kegel. And that is where you're going to tighten those muscles and you're now going to hold for a count of 5, 4, 3, 2, 1. Relax completely for a count of 10. You need to relax these muscles so that you can get them ready for the next contraction. Then you're going to, again, contract and hold using the cue that you use for 5, 4, 3, 2, 1. And then you're going to relax completely for a count of 10. That is traditional Kegel pelvic floor muscle training, which is intended to help with leakage, to help thicken the muscle, for support for the structures, and to help tell the bladder to relax. And the goal will be to do 3 sets of 10 per day. You're generally going to start these in laying, then progress to sitting, and then you can progress to standing, but only if you can still continue to relax completely between. The next one you're going to work on are going to be rhythmical contractions. And rhythmical contractions are important for coughing, sneezing, reacting to a fall, going from sit to stand. And with these, you're going to use that one of the cues, whether it was the anatomy cue, rose, blueberry, turtles, or nuts to guts. But you're going to be doing a full contraction and a full relaxation rhythmically. And it's just up and down. And you're going to start slow. Your goal will be to do 10 in 10 seconds, but it's more important that you start slowly and just get a good contraction relaxation. It requires flexibility in the muscle, and it's training the muscle to react, which you're going to need for a variety of conditions. And the final one I want you to be trying at home is to see if you're doing the knack. And that's because the pelvic floor muscles should automatically have the knack of being able to contract when you cough, you sneeze, you lift something heavy, you go from sit to stand. And many people, this is a piece that they have lost. They've lost the knack. And an easy way for you to figure that out is to do a cough. You're going to put a hand over your belly, and then you're going to just do a cough. If you have maintained the knack, your stomach muscles will come in. If you've lost the knack, you're going to find you cough and your belly comes out. So before I talk to you about how to train the knack back in, just try that. So try a cough. Did your belly go in? Did your belly go out? If you need to train the knack back into your daily habits, what you're going to do is you're just going to do a strong pelvic floor every time you cough or sneeze or lift. That, if done consistently, will change in a week or two. It doesn't take much to train it back in. So that's something you can be working on now. As I said, listening to this and doing this for about 2 to 3 weeks should make a difference in your symptoms. If it isn't, you need to talk to your healthcare team about what may else need to be done. And there are a number of physiotherapists that can help you with this. So in this session, you have learned how to find your pelvic floor and where it is. You've learned what the cues are that are going to help you with contracting and relaxing your pelvic floor. And I've given you 3 different ways of working your pelvic floor. Changes in pelvic health function are typical with aging, but in my opinion, do not have to be considered normal. There is a lot that you can do to help yourself, and there's a lot of help out there for you. If you would like more help from our clinic, you can contact CURA Physical Therapies at 780-443-4473 or email us at patients@curaphysicaltherapies.com. I hope you have found this presentation has given you some hope in managing your pelvic floor problems. There is help out there. If you need more help, please get it, as you don't need to be managing these symptoms on your own.
So I'm often asked about what one can do to maintain bladder health. And that's quite a difficult question to answer, because it seems that, again, most bladder dysfunction may be associated with aging. So many of those typical things that one needs to do in terms of healthy aging become relevant. In terms of maintaining bladder health, we know that the usual precepts of healthy aging are important. We know, for example, that a Western so-called highly processed diet is associated with an increased likelihood of developing bladder dysfunction over perhaps 2 years. Now, although there are no studies which examine a healthy diet and its impact on the bladder, it's likely that this unhealthy diet effects can be reversed. So diets which are high in processed foods, high in fizzy drinks and additives appear to be worse for you. Now, whether this seems to act through diabetes or through obesity is difficult to determine, but obviously avoiding those is important. The second thing is fluid balance. Many people with bladder problems restrict their fluids, and this appears to be the wrong thing to do. Avoidance of caffeinated drinks and perhaps artificial fizzy drinks is important in reducing the impact of symptoms. The third component would be exercise. Physical exercise is associated with a greater propensity of having a healthy bladder habit, but also being able to deal with any symptoms such as urgency, which give you the feeling of needing to go to the washroom in an urgent manner. The final thing to mention is, of course, that bladder dysfunction and pelvic floor dysfunction per se is not normal for getting old. The fifth tip for maintaining bladder health is to recognise when things aren't right, not to accept them as being normal for getting older, and to seek adequate support and healthcare as required. There are many things that can be done to alleviate the problem and to perhaps cure the problem. So seek help early.
Thank you so much for watching this episode of OLTV. If you liked what you saw and you want to watch more, like this video and subscribe to the Optima Living channel right here on YouTube.